get into the nature of intracrine hormones versus endocrine hormones. And so your blood work, even though even testosterone doesn't tell you as much as you think, with estradiol and DHT, it's almost useless, like because you're not converting, those compounds aren't converting in the bloodstream. We have this idea that you take testosterone and magically poof, it just converts in the bloodstream to estrogen and DHT and they wreak havoc in the body. And it's like, that's not how it works. It has to actually get into the tissues, then is converted into these things. Well, that's different depending on the tissue. The tissue has different needs. It's designed differently. So once you realize that, you kind of get out of that lab range mindset with those two things. And even DHE and pregnenolone, in my opinion, kind of follow those same rules. And so then you're more trial and error with a lot of that stuff. With testosterone, though, in general, I just realized a lot of guys weren't feeling better when you get them to 700, let's say, in a free T in the teens. And they're just like, oh, I mean, maybe, doc, I don't know. And then you push a little more and their symptoms start resolving. And it's like, well, there's something to this, and
Yeah.
other doctors, I'm not a trailblazer by any means on that. I mean, Neil Rouzier has been talking about that for a long time.
Oh yeah,
Dr.
like
Nichols.
20 to 30 years or something
Yeah.
like that.
Yeah. It was really a lot of stuff he said that helped me go look deeper into other stuff, And so now that I've done it, I think I finally was just like, I'm going to have the balls to do this and stick by what I say. And let me just try it. And the more I did it, the better people got, and without negatives, they're not running around with growing boobs and having strokes and any of this nonsense that people say is going to happen.
hmm
I knew that, I mean, coming from like a big steroid background and having a lot of knowledge on that stuff, that even a lot of that's overblown. Yes, there's dangers. I'm not going to act like those guys are not walking disasters a lot of
Substance
times.
abuse is substance abuse. Let's be real.
That's right. Exactly. But when you do a basic lower dose, to get people just therapeutic, and your body will tell you when there's problems for the most part. Like when you start having resting heart rate of 100 and you feel tight chested and you know what I mean, you're red faced and you can't keep an erection and your testosterone's 3000, your body's telling you something, like, and so
Yeah.
that's been my protocol with a lot of guys is be honest with yourself. Don't chase the number because you just want to be as high as possible. If you start feeling worse when you go up, come back down to where you felt better. And that's going to be probably your sweet spot within reason. And that works most of the time.
Yeah. Yeah. And you were just saying like a lot of guys are afraid to grow boobs, but the reality is estrogen isn't it's not going to make you grow tits. It doesn't do that.
The only time I've had gyno, it's still there. It'll regress and grow. It's not with testosterone. Anytime I've taken nandrolone, I'll get the lump and painful, hard, like, well, nandrolone doesn't aromatize. I mean, I know people say, oh, it does 20%. There's no evidence for that. I mean, every study that's done on androlone,
Yeah.
it can't undergo aromatization because it's already a byproduct of the aromatization
Yeah. It's
process.
already gone down the process.
Exactly. And so a lot of people don't realize that. So it's like it's probably just that direct progestin activity on the glandular tissue there. Same thing with IGF-1 levels. A lot of guys,
IGF-1. Yep.
yeah,
hmm
taking GH or they'll take MK677. All of a sudden they're developing gyno. It's like, well, did your estrogen flare? They want to blame it on estrogen, want an AI. It's like, no, it's just multifactorial. There's stuff going on there that we don't fully grasp. So I don't know how I got off on that tangent, but it's a little more complicated than just this. Oh, it's got to be that one thing, or
Yeah.
to blame. Yep.
There's no such thing when it comes to the hormones as A equals B, or if you take this, you will get that. No, there's no blanket statements to it.
Exactly. If you make these, I had a guy recently wanting to clear up his acne, and he was on injections with grapeseed oil. I was like, well, let's try MCT oil. And he's like, okay, doc. And I said, if that doesn't work, we could try cream. And he's like, okay, so if cream, it'll definitely clear up my acne. I said, there is no definitely.
There's no,
I will
no.
say it ain't gonna happen. The only thing I can definitely tell you is that you're gonna die someday, and that's about all I know.
Yeah.
That's
And
it.
I don't even know when it could happen tomorrow.
I
It could
don't
happen right now. Who knows?
exactly. Yeah, like that's pretty much. When they say death and taxes, it's like, yeah, that's pretty much it. That's it. So, but you're right. We have to be careful with a lot of the dogmatic claims, and I've been guilty of that in the past when I was early
Sure.
on in this. And the longer I do this, the more I realize how little we truly know. And I use know. I mean, it's fine. Again, that's an epistemological issue. You go down a philosophy rabbit hole and you realize, how do I even know that I'm not dreaming this right now? Right? You can get in that rabbit hole. When I say no, I mean infallible knowledge, like can't possibly be wrong. That that's minimal stuff, right? We are going with opinion, a lot of times consensus, even though we say we shouldn't. That's why I say be honest about that and be honest with each person that we don't fully know. That's why we're going to try to find the best route for you to get you feeling where you want to feel. And I think that's the more pragmatic side of hormone optimization, is admitting I don't even care if I'm treating a quote unquote deficiency or not. I'm trying to make you better, feel better, function better, have
Hmm.
better health. What's wrong with that? I
Nothing,
don't, you know?
nothing wrong with that.
Yeah. Yeah.
Have you,
So,
so on the topic of endocrinology of hormones, like we're even learning that thyroid hormones, those are endocrine hormones too. T3
right.
express itself at the cellular level. The PBN picks it up, and then what's reflected on paper doesn't mean a damn thing to what's going on at the cell. We
Exactly.
learn all this stuff every day.
Every day.
No,
Yep.
I'm
Yep.
kind of curious what led you to kind of find that, like study in the more
So
the intricate side, because
the,
there's no benchmarks to that. There's
yeah.
none.
Well, you can't. I mean, you can't do it. And
You
I
can't
was talking
measure
about this.
tissue.
Yeah, with my patient on Friday, we were discussing it about how you'd have to literally do tissue biopsies all the time in different tissues, and then you're still correlating levels with symptoms. You don't know if it actually means anything causative.
Mhm.
Nobody's going to do that.
Nah,
Uh, I think what got me into it was the estradiol topic, because that's the hot topic. Everybody wants an AI, and I mean, I took an AI when I got on TRT.
dude, I bought into it 10 plus years ago
Yeah,
too, man.
I mean, I felt terrible, and I'd keep my estradiol at, like, I was unregisterable at one point, because I thought I needed to check it and all that, keep it between 20 and 30 and all this crap. Um, I think the first time a little light bulb moment was in Shreveport. I put a guy on an AI because his estradiol, we checked it, it was over 100, and I was like, well, I guess he needs an AI. Well, he felt worse, and I was like,
Mm.
okay, that doesn't make sense. Well, so I took him off that, and we just bumped his dose up on injections. Well, about a month or two later, he comes back. He's like, feel great. I was like, okay. So I just kind of tucked that away. I didn't really think about it too much. And then when I got to Paris, is when I I saw Rousier's video with Jay Campbell where he's going over estrogen and all that, all that whole rabbit trail. And it just piqued my interest. But he still never really touched on anything about the blood levels or anything like that. So I finally just started looking at papers on estradiol. And when you start tracking back references, you get back to older papers from the 70s where they were really studying DHEA, which is also an endocrine hormone, right?
Yeah.
And this guy was started to talk about how these things are converted in the tissues. And you start seeing these little snippets in all these different papers that say serum levels of estradiol are nearly useless in males and postmenopausal females. And it was like, that's interesting. Like, why do they keep saying that? I've
Was
not
it
ever
in
been told.
small footprint? Was that
Exactly.
there?
You're like, so this is all the researchers are saying this, and these are in these big journals. Why are we not taught this? And I had to figure out why that was. Well, the light bulb moment is once you understand where it's made in the tissues, then you understand that the serum levels are, that's why they're saying it, right?
Hmm.
Because it's not converting, it's not an endocrine hormone at that point. Now that's different if you take a hormone, right? And a lot of guys would strawman me and say, "Oh, Dr. Grant just wants you to take estrogen, estrogen." And I'm like, "That's not at all what I said. We're talking about aromatization, which is a conversion in the tissues. Therefore, the blood levels aren't that useful. If you just started taking estrogen, your estrogen in your blood is going to skyrocket, right? We know that. Like, why would a man take estrogen unless he was castrated or needed it for some reason?
Sure.
Most men don't need to be taking estrogen, in my opinion. I think bodybuilders might, when they're taking like no aromatizing compounds, it
Yeah.
probably would
And
be
they're just
beneficial.
completely depleting their body.
Exactly. But once I understood that, then you look at DHT, same thing. It's the same process, converted in the tissues. So all these people want to check their DHT levels and take finasteride and all this nonsense. It's just not necessary. And almost every time you see guys take these things, finasteride and AIs, they feel worse. They have
Yeah.
big issues. And it's like, well, those are poisons by definition. And I know people don't like me using that word. They're like, oh, that's dogmatic. No, just look up the definition of what a poison is.
It's something
Something
that
that
harms you, man.
disrupts a natural process in the
Yeah.
body, right? Well,
Yeah.
that's what you're taking by definition. So, and I know the poisons in the dose and all that. It's like, yeah, kind of, but you're still poisoning yourself. And then you have to ask yourself, why am I doing this? Do I really need to be doing it? Is it a dogma? Do I have evidence that I should be doing it? And I just started asking that question more and more, like, where's the evidence that we should be taking AIs and modulating serum estradiol levels? And it's just not there. There's no evidence, none. And then you get into the anecdote and people with, I'm crying, so it's got to be estrogen. It's like, why do you think that's estrogen? It's all these presuppositions come out in the way people say things. So you kind of got to dive down into that. And you can't spend your life arguing with people like that. But I'm pretty clear with my patients about where I stand on AIs and
Yeah.
5-alpha reductase inhibitors. So they kind of know already. So
Yeah, that